I'm Dr. Suresh Advani. I would like to explain the newer technology and newer modalities of treatment in terms of the delivery system to the patients. As all of you know, the world is changing, so is the landscape of the treatment in oncology is undergoing tremendous change. Today, the number of cancers are increasing all over the world. And all of us know that the changes in the lifestyle is making a big impact in terms of the number. In females, breast cancer is number one, and in males, prostate cancer is number one. But there are many other who are after that. See, carcinoma of cervix in females and lung cancer in males is number two. So the load of oncology cases is increasing all over the world, and every hospital, every medical institute has realized that. And therefore, everywhere in the hospitals, private or medical, government hospitals, the oncology has become second to the cardiology in terms of development. Particularly in oncology, the changes have been very clear, not only in terms of the new technology, but also the results. The results have changed. There are so many diseases which were not curable before, like all childhood cancers, the carcinoma of the testes, and GIST, similarly, chronic myeloid leukemia. All these diseases have become curable from a stage where only about 25, 30 years ago, they were totally incurable. So I think there has been major impact in terms of the treatment outcome in various oncology fields. However, the limitation is in terms of the facilities, in terms of the distances the people have to cover to receive treatment. Treatment is not yet available at the doorstep of the patients. They have to make an active effort to travel, come to the center, wait for their time and line, and then receive the treatment. So to receive the best of the treatment, which everybody would like to receive, is a Herculean job, not only in terms of the patient, but their relatives and their family members. So I think this is where what we have seen today, the changing pattern of delivery system in terms of the treatment. Today, most of the hospitals are gearing up to have the oncology department. Even at the periphery, they have the oncology departments. However, still it remains within the hospitals where it has its own problem. But realizing that they are, particularly in the medical oncology, that the treatment is quite simple and well organized in terms of the protocol and can be delivered outside the big hospitals. And that's where I think the progress is happening. Today, the daycare, which have come up all over the India, as well as in many other countries, they can deliver almost 80% of the treatment in a setup which is near home, so that patient and the relatives don't have to travel long distance. And I think this is a major change that we have seen in the last 5 years or so. And time may not be very far where all this treatment, including some small surgeries, will be done in the daycare. The delivery system in the daycare is quite simple because obviously it's not overloaded, and therefore one can have a control on that. Plus, daycare, if it is well organized, I think the waiting period also can be totally minimized. So a patient can quickly come, take the treatment, go home. I think that is going to play a very important role in terms of attracting the patient to reach to the daycare and take the treatment over there. Now, in medical oncology, the treatment has undergone change. We have got the chemotherapy, which has been there a long time. Obviously, the chemotherapy has also changed. We have many more drugs today and more drugs to come. And so, all of them, the attempt is that they can be given easily in the daycare. So, the delivery system has remarkably improved. Some of the drugs which previously we thought is so very difficult to be given, today we can give it without any problem because that part which causes the side effects have been taken care of. Today, no patient on chemotherapy vomits. Why? Because it's very simple. We have a wonderful antiemetic therapy which is given before the chemotherapy. Similarly, we don't allow the blood count to go down. We have drugs which we give after the chemotherapy to take care of the WBC count. So one can see that treatment has become simplified, and also not only the treatment but support system has become very active and effective. That's where treatment has become simple, does not require hospital admission, and patient can really be very much at home or even go to work also. So I think that's very important. Apart from the chemotherapy, the other developments are immunotherapy. I think in the last 10 years, we have seen a maximum change in the landscape of the organized treatment for cancer. There are so many diseases where we had nothing. Renal cell carcinoma, we had no treatment. Today, immunotherapy works in this condition. Similarly, in a condition like lung cancer, we had very little treatment. Today, we know that lung cancer, the average survival can be 5 years, which was unheard of even 5-10 years ago. And there are few patients who are living longer in the 5 years and are probably cured. So the word cure in lung cancer was never mentioned before. But today we can claim that we have the patients who are drug-free after a long period of time. So the immunotherapy has a major role, and again, it can be given under the medical supervision at the periphery, the daycare centers. That's where the daycare centers has to be not only good in aesthetics, but also good in the human resource. In other words, the doctors, nursing staff have to be absolutely knowledgeable so that they can deliver such a complicated treatment very safely at the daycare. Now, apart from the immunotherapy, today we also have what we call it targeted therapy. That's a wonderful development which has occurred. Like in lung cancer, we have certain type of the lung cancer. They may have a mutation in one of the gene. We call it EGFR gene. And if the patient's tissue shows EGFR gene mutation, we can treat such patient with the tablets, which is just not even came in our dreams 10 years ago. But today we can. Similarly, there's another gene. We call it ALK gene. It's a drug tablet which works wonders. They remain absolutely under control of 5-10 years. And there are many other genes which we are able to determine their mutation and give the targeted therapy. So all these developments have occurred. The important thing also that there has to be multidisciplinary approach. It's not only the knowledge of the tablets or immunotherapy or chemotherapy, but the multidiscipline. That means we have to have the surgical oncologist along in such a situation, also have the radiation oncology. And I think now the radiation machines are also becoming smaller and smaller, and they can be put up in the distant peripheral center, including the daycare. So I think overall developments are very important, which are happening, and it's the right time for all of us to think and develop such center so that ultimately the beneficiary is one most important is the patient. The patient will really feel that they are going to be benefited with very little effort. Similarly, the delivery system to the patient by the doctors also will improve, and therefore doctors and the medical personnel will feel very happy that they are able to deliver the right treatment at the right time. And lastly, the whole system of the hospital will also feel benefited, basically because they feel that the day-to-day routine work, they are not pressurized by that. And therefore, they will more concentrate on the emergency, they will more concentrate on complicated surgeries, which can really give a much more efficient hospital system. So I think for everybody, it is going to be beneficial, the daycare centers, the hospital, and the patient. That's the most important. So I think the time has come that our patients will receive best of the care near. Thank you.
Very good, fantastic.